For over 60 years, women have had the option to use a birth control pill to prevent pregnancies. This option, however, has not been available for men. Nearly half of all pregnancies are unintended, which means that the current existing family planning options are inadequate. For men, the only choices are condoms and a vasectomy. However, in the past few years, scientists have been experimenting with different compounds to see whether these substances could be used as birth control for men. Multiple different substances, with different working mechanisms, have been tested for their efficacy in preventing pregnancies. Today we will be discussing two different compounds that have shown promising results for being used as birth control for men. Nest-T, Nesterone, testosterone, is the first birth control product for males that has moved past the initial steps in the clinical trial process. Nest-T is a hormone-based clear gel that men apply to their skin daily by rubbing it into the skin of each shoulder blade. The gel has two important functions. First, inhibiting sperm production. Second, maintaining sexual drive and function. The effects of the gel are reversible and sperm levels return to normal in about 4 months after a man stops using the product. The gel includes a hormone called nesterone, also known as segesterone acetate, which inhibits the production of testosterone in the testes, which, in turn, causes the production of sperm to decrease. Nesterone typically lowers the production of sperm to less than 1 million sperm per milliliter, compared to the normal 15 to 200 million sperm per milliliter in a healthy male. However, nesterone alone does not make a great male contraceptive, due to the fact that inhibiting testosterone production in the testes lowers testosterone in the blood, which would reduce sexual function and libido, and other testosterone-dependent activities. To prevent this, the gel also contains synthetic testosterone to maintain normal blood testosterone levels without increasing testicular testosterone to a level that would restart sperm production. The two active ingredients in Nest-T are already considered effective and safe for use. Several couples who have used Nest-T and completed a 2-year study have opted to have children. Their rates of conception were similar to those of the general population, which proves the reversibility of Nest-T and shows that the future fertility of users will not be impaired. Another substance that could be used as birth control for men is an adenylyl cyclase inhibitor. Adenylyl cyclase is essential for sperm motility and maturation. An adenylyl cyclase inhibitor disrupts its function, which renders the male infertile. There exist many different adenylyl cyclase inhibitors. A safe and acutely acting adenylyl cyclase inhibitor with long residence time was synthesized and tested in mice. Residence time is the time a drug spends in contact with its biological target. The study was published in Nature Communications. The compound named TDI-11861 rendered male mice temporarily infertile, however, the full fertility returned the next day. Just like other adenylyl cyclase inhibitors, the treatment of sperm with TDI-11861 in vitro blocks capacitation, which is the maturation process a sperm cell must undergo to gain fertilizing capacity. However, TDI-11861 has a longer residence time than previously known adenylyl cyclase inhibitors. If the tested adenylyl cyclase inhibitor was found to be safe for humans and approved by the FDA, a man would take a birth control pill shortly before sex, as needed, to prevent unwanted pregnancies. Thank you so much for watching the video, and we hope you found it informative.